And do I need to be anywhere close to this, or is it wherever?
Right, you're good right about where you are.
Okay, just leave it.
Yep. Welcome everybody back to Harbor Discussions. Today I'm with Dr. Ann Edwards. She is the founder of Restore Therapy Spa, and she's a doctor of physical therapy. Real quick, just promote the social medias for the spa and just let people know where it's located and where they can book an appointment at.
Yeah, so we are Restore Therapy Spa, and that is basically how you look us up on Facebook and on Instagram.
Okay. And it's located in Carroll County. Where's it at?
So we're at 914 Washington Road in Westminster, Maryland.
And is it restoretherapyspa.com? And
Yeah,
that's where you book appointments, right? Or you call?
yeah, yep,
Okay.
yep.
So first question is, since the spa is located in Carroll County, is that where you've lived your whole life?
No, I grew up in Pennsylvania, Chambersburg, Pennsylvania.
Okay.
Was there till I went to school at Penn State. So was
Gotcha.
there for 4 years, enjoyed that, and then off to Arlington, Virginia for physical therapy school.
Gotcha. So how would you kind of describe your upbringing?
So lived on a 40-acre farm. My parents owned a greenhouse business. So I was selling plants from the age of about 8, 9, 10, something like that.
Okay.
Helping out around the greenhouses, watering, transplanting, doing tickets on things, whatever I could do to help out.
So that herbalist, naturalist lifestyle has always kind of been a thing for you then?
I would say somewhat. I would say I'd like to be healthy growing up, although you know, asked my parents as a kid and even into high school, didn't really like eating my vegetables.
Who does?
Favorite food was bacon. Uh, Eat like steak, like we would go anywhere and I would eat steak. So it wasn't until really I got into college and grad school that I started to appreciate a salad, and looking into more nutrition and things like that.
I gotcha. So did you have any family that was in the health and medical industry at all that got you to where you're at?
No,
Okay.
not at all.
So I read you were PT doctor, physical therapy doctor for over 20 years, right?
Mhm.
So what led you to that career field? And you said you went to where? Arlington? You went to Arlington?
Marymount was my grad school, so that was
Okay.
for physical therapy. So when I was at Penn State, I was interested in pre med, something going into health field, but I didn't really know kind of which direction I wanted to go. Then I volunteered at the Penn State. Kind of health clinic where they had the physical therapy for the students, and I really liked it. So then I went and did some more volunteer at other clinics around the area, and then I decided that was the route for me.
So what exactly were you doing during that program and stuff? What did that
Oh, you
entail?
just help out. I mean, it was, just helping out and doing laundry and observing and helping out around the clinic however you could.
Okay. So where have you worked as a physical therapy doctor over the years and kind of talk about what your jobs entailed over the years?
So I started off with NovaCare physical therapy for 10 years. So that was a great place to work. I was promoted to manager into my second year with them. So then I was in Bel Air at first, then moved out to Tawny Town, and I was there for 9, 10 years or so. So that was a really good experience because I was the only physical therapist. It was a small town, so I saw everything from infants to 100-year-olds. So I was really treating the gamut and every condition you can imagine. So that was a good experience for the management side and the treatment side of things.
I gotcha. So as far as the things you've done over the years, is it mostly helping people that have been through injuries and stuff like that? Is that what mostly physical therapy is?
Yes, yeah, it's a lot. I mean, in an outpatient facility, it's a lot of after surgery, so a knee
Okay.
replacement, hip replacement, something like that,
Gotcha.
or somebody who just has back pain or a slip and fall or something like that, where they hurt themselves, or sports injuries. There's a large range.
Okay. How would you describe your experience as a physical therapy doctor before opening the spa?
So it was more it was the outpatient setting, and I did a little bit of home care, and I did a little bit, in a private practice. So it was It was good, but it wasn't exactly what I was looking for. I wanted to kind of branch out. I started taking dry needling certification, so I got through all of those courses and got certified. And at that point, I said, I think this is what I want to do. I want to proceed with, getting my own practice and just kind of building out my own book and not doing it for a company,
Okay.
basically.
So how did you get interested in dry needling then?
So dry needling is fantastic. It's a great way to loosen up muscles, and I would do that with my hands before.
Okay.
So when I was treating my patients for those 10 years, I found the best way to get someone better was to figure out where their trigger points were, and release them. So that would get them better in terms of their range of motion would be better, their strength would be better, they'd feel better. But it takes a lot longer to
Right.
use your hands. So using the needle, I could get the results 10 times faster.
I gotcha. What's funny is like one of the first times I was at the spa, I ran into one of my old like teachers that I went to school with, Miss Sabat, and she told me how another teacher, Mr. Whitty, told her like dry needling's the shit was the quote that she used. So I was like, okay, I haven't done it yet, but it's definitely been like kind of in the back of my head and stuff.
Yeah, I mean, I've got quite a following with it that people, it's really, I think, life altering for a lot of people in
Right.
that, I see people that have maybe been in pain for 10 years and have tried the list of different things, including medicine and regular physical therapy and chiropractic and all of it. And the needling is what makes the difference.
I will definitely have to throw that in at some point.
Yeah.
So, you just you got into it through your physical therapy career, basically.
And through the dry needling.
Yeah. Okay. Um, and then who do you recommend those sessions for?
Dry needling can be good for anyone with muscular pain. Sometimes that's hard to tell. So it's really, I mean, your neck pain, back pain, shoulder pain. You're playing tennis and you tweak something, or your golf game's not quite as good as it could be because your back hurts every time. Or there's somebody who is in chronic pain. There's people that are trying to get away from pain medications and things like that. So really, there's a huge population that could benefit as long as there's some sort of muscular cause to their pain.
Okay. Do you know the history of it at all?
So I know that it goes back to, I would say back to the 60s and 70s. So there is a physician that treated the President Kennedy for his back problems, and she used these techniques.
Okay.
And she would actually inject medicine into the trigger points. So instead of like we're using a very thin needle that doesn't have any medicine in it or anything. So it evolved from having to inject the medicine in to they realized they didn't even need to do that. That was the presence of the needle touching the muscle that would cause the reaction.
Okay. And like just to be clear, this is different than acupuncture, right? Okay.
Yeah.
I feel like that's probably gets
That's
mixed up a lot.
Yeah, that's a common question. So acupuncture is more treating the meridians and the flow of energy in the body. They're using needles for a different reason than I am. So I'm looking at it as a physical therapist. There is this muscle that I want to treat, and I'm using the needle to treat it instead of using my hands to treat it.
Okay. Gotta find where I was going. So I guess I would say, how did your wellness journey begin? And to kind of broaden that question, how many of these services like were you using before you opened the spa?
Okay. So I would say my wellness journey began with something bad, really. I had melanoma skin cancer 13 years ago. So diagnosed with stage 3. Which is pretty bad. Yeah, it's one step away from really bad. So I had to go through 2 surgeries within a week. They took out my lymph nodes, all of that. So I had a pretty long recovery from that. And during that time, I was like, I'm in my 30s. Why am I being diagnosed with cancer right now? So that started me looking into a podcast and looking at different professionals talking about natural cancer treatments and everything I could learn. during that time when I was just, I was bedridden anyway. I couldn't do much. And I found out some amazing things that, you really can control kind of what can happen to your body by a lot of preventative, alternative treatments. It does matter what you eat. I was somebody who was eating Pop-Tarts for breakfast every day, prior to the diagnosis. And I looked,
Right.
and sugar feeds cancer. So I went on a really good cleansing diet. I didn't have any sugar for months. I was eating just vegetables. And, I really was working on just allowing my liver to heal and everything necessary to, allow my body to heal from the cancer.
I gotcha. I've mentioned this before on my platform. It's like it's really simple stuff that you do. It's like you just got to drink a lot of water, not eat crazy junk food,
Right.
and get 10,000 steps or whatever. Just get moderate exercise, go out in the sun a little bit. That's about it.
Right.
You do
right.
those things and then you're pretty much good.
Right.
So, what's your history with some of the services that you offer, like saunas and things like that? Like, what were you doing before? What made you choose some of the things that you have at the spa right now?
I wasn't doing any of those things before. So I looked into whole body cryotherapy was really the catalyst. Looking into that, and that intrigued me, just the way that it would boost the immune system, reduce inflammation. It sounded like a perfect complement to dry needling and to pain relief.
Gotcha.
So that was really the first thing that I wanted to get into. And I'm like, well, what's a nice complement to the cold would be a sauna. So infrared sauna, looking into that has good cancer fighting properties and so many good things. So that's really where we started. Was we went from me just being an individual provider. It was just me in the office. I was doing everything, and then I said, okay, let's. This is when Restore really was born, and we moved into a smaller location where we had, me doing dry needling, we had the cryo, the sauna, and then we had things like the Soluma were nice complements, the light therapy, and the Normatec. And then we had a couple massage therapists that were just kind of renting space from us. Was really the beginnings of Restore.
Okay, so you decided to go from an individual practice to a spa just because of how well the services kind of complemented what you were already doing. So how did you hear about cryotherapy and stuff like that?
I don't even know. I feel like maybe patients even brought it up to me, and
Okay.
they were interested. They knew they were going other places and trying it out and things like that. So it just sparked my interest, and I did the research, and it made sense scientifically, and so we proceeded.
I think for me it was Joe Rogan or something like that. He talks about cryotherapy and saunas because he does that stuff on a regular, and like
Okay.
people do like cold plunges and stuff like that, and ice baths. That's pretty popular.
Yeah.
You ever have any history with
I can't
that?
do that. No, I went to this one spa once where they did these alternating hot and cold, and this is when I went to try cryotherapy for the first time. And they wanted you to do like this like ice cold shower thing after you were in the sauna, and that just felt horrible to me. I mean, after was nice, but yeah, I feel like that's extreme.
Definitely.
And those that can do it, I've props to them. But I feel like the whole body cryotherapy is a way for most people to be able to actually get the benefits of something like that.
I gotcha. So what would you say makes Restore Therapy different from other spas? And kind of describe the holistic aspect to it.
Yeah, so we're more therapy oriented and wellness oriented. So a traditional spa, you're just going to have more of kind of the they'll have the massage and the facials and things like that, but we're clean. So we only use like clean ingredients. When you get your massage, it's going to be organic oils. When you're getting your facial, there's not going to be preservatives and chemicals and things like that in it. So
That's big.
yeah, it is because especially if you're trying to live a clean lifestyle and you're trying to take care of yourself, you don't want to be infused with toxins. So that's really the foundation of Restore is detoxifying people. So we want to make sure that we're not putting more toxins in.
Gotcha. That's a big problem, like especially like a lot of the soaps and stuff like that that people use, brands like Axe and stuff like that. It's like there's commercials for like Dr. Sasquatch, which is a more natural soap, and
Mm-hmm.
they basically compare the other soap brands to detergent that you put on yourself.
It's true.
So yeah, I mean, I've looked into that stuff, and it's definitely like you notice a difference. You know what I mean?
Mm-hmm. You
That's
do, and it messes with your hormones and their endocrine disruptors. There's so many problems that you can get from just getting a generic product that you're putting on your body, on your skin, that gets absorbed into your bloodstream. I don't think people realize that that's like you're putting these chemicals into your bloodstream.
yeah, it's kind of the same thing with bad food too and stuff like that. It's hard to kick,
Mm-hmm.
like bad food habits and stuff like
Mm-hmm.
that, especially because a lot of them develop really young and stuff like that.
Yeah.
I've gotten better. I'm still trying to kick chips and stuff like that, but
But there's a healthy chip and there's a not healthy chip. I think it's better to eat something, that's in a, non-GMO oil or something like that versus something that's caked in that yellow cheesy.
yeah, the people that listen to me on my podcast, they've heard me talk about this all the time, but I feel like I just have to bring it up. I work in a warehouse,
Mm-hmm.
and like the people, like I see so many unhealthy eating habits that it's really like that. A lot of that inspires me to turn my stuff around
Yeah.
because people eating like bad vending machine options,
Mm-hmm.
like for morning, sodas in the morning with,
Right.
like pastries and chips and stuff like that.
Mm-hmm.
And it's like, I've been unhealthy before, but I'm like that's crazy.
Yeah. Yeah.
And then they complain about
Not feeling well.
exactly.
Right? And you
Yeah.
say,
I make it a thing now to stay like well hydrated and stuff like that, and that alone has helped a lot.
yeah, it does.
And making sure to get like electrolytes and minerals and stuff like that, it's really important.
It is.
And that's like you sell like mineral supplements and stuff like that, so were you kind of taking those before?
No, that was I was doing a deep dive into lymphatics. We decided last year to really have a focus on the lymphatic
I
system.
have a note about that, so definitely get into that.
Okay. Yeah. So really, the lymphatic system it governs everything in your body. So it is your waste disposal system. So it is what is carrying all of the toxins out of your body. If you're backed up in your lymphatic system, then you're just going to be storing those toxins in your fat cells. So that can cause not just weight gain, but all kinds of problems, brain fog and fatigue and you name it. So and that's part, like we were saying, how detoxification was so important, so that we felt the lymphatic system was really where we wanted to focus. We try to incorporate that into all of our massages and our facials, and giving people a little bit of a lymphatic cleanse per se, with their treatments, so that they're benefiting even more from the treatments.
Gotcha. um So this interested me when I first started to look into the spa because I worked in construction for about a year,
Okay.
and I was an apprentice for electrical. So I was getting down really low to do all the plugs and stuff like that.
Mm-hmm.
And I can do labor and stuff like that all day, kind of no problem. But I had to wear tools a lot, so I was wearing like easily 10, 15 pounds of tools on my waist. So I started to develop back pain and stuff like that because I'm also loading stuff to the van, carrying them up and down flights of stairs. So eventually I left because I was like, this ain't for me for a multitude of reasons.
Right.
And I continue to do sort of physical labor. So I decided to look for a place that did massages, and y'all were rated Carroll County's best massage place.
We were, yes.
So talk about that.
Yes. Yes, and honorable mention for physical therapy. So that's pretty exciting. Yeah. So we were voted the best in Carroll County. So, and I think it's true. I'm very particular with who we hire in terms of massage therapists. Very tough part of my job is that I have to vet the massage therapists as they come in, and we do demo massages. But as a physical therapist, like I have a strong standard, I guess, that I need to make sure they know the muscles, they know what they're doing.
Oh, for sure, yeah.
Yeah, because otherwise a massage is nice regardless, but we want to make sure that it's the most beneficial. And I think it's been at least a year now. I've been meeting with the massage therapist every month, and I've been teaching them trigger points. So we've been talking about, different parts of the body each month, whether it be shoulder problems, and we talk about all the muscles that could refer into the shoulder. So if, a client comes in and they're having a certain problem, it might not be obvious that they need to just work on the shoulder. There might be muscles, towards the neck or
Right.
on the back or other areas that they need to actually focus on in order to help the client.
Yeah, I can personally say y'all do a good job at pinpointing them up because like
Mm-hmm.
it's really hard to describe other than just like they know exactly where to go
They do.
because it's like I can't describe my like I go in and they do their best to ask me questions and I'm just kind of like I don't know, my back.
It hurts.
Yeah, and then they managed to, and I'm like, damn, I didn't even know it was right there.
Hmm.
Yeah.
Yeah.
Great job.
Yes. Thank you. Thank you. I'm proud of them all.
um, so this is what interested me. Um, it's it says we believe that our patients deserve a certain level of care which cannot be achieved in the insurance-based physical therapy clinics. So you guys don't take insurance.
Correct.
So kind of talk about what you meant by that because I just found it interesting. So, have you experienced or seen that in insurance-based
Hmm.
clinics that you don't receive the level of care that you otherwise would in others?
Yeah, I mean, I'm sure there are exceptions, but I mean, I was in that industry, and you do the best you can. But I mean,
Right.
it's a corporate-led, financially driven system where the more patients that the therapist sees, the more money that the company makes, and the insurance companies are getting worse and worse and worse with reimbursement. So it's really hard to be a sustainable business with accepting insurance and being able to spend your time with the patient. So if I was treating in an insurance based practice right now, I would probably only be able to spend maybe 10 or 15 minutes with my patients
Mm.
doing the hands on therapy. And the rest would have to be doing exercises, maybe not with me, but with a tech or something, so that we can charge enough in order to cover even my salary being there, the front desks and the insurance, person that runs the insurance and the rent and all of that. So I understand why it is the way it is, but I wanted to set it up where that didn't matter, and I wanted to be able to do with my patients what they needed, and what they need for the most part is to have my hands on them, treating them, and then I can give them exercises to do at home, but I don't need them for them necessarily to be doing them in front of me.
Right.
So I just make sure I'm giving them 2 or 3 key exercises. They do them at home, and then the next time I can switch them up if
I've
needed.
noticed that's a kind of a thing no matter what you're doing at the spa.
Hmm.
You have the wellness prescriptions and stuff like that. Is that something that you've kind of adapted to your own spa? Have you seen that at other spas or anything like
No, we
that?
just invented that a few months ago. We brought that in, and it was really, the goal was to be able to guide the clients and patients as they come in, to guide them towards what we feel they need. And that's part of what I've been training the massage therapists and the other providers. Like, you are a skilled professional and you know what this person needs.
Right.
Someone coming in off the street, they don't know that, a massage once a week is going to benefit them. But once you treat them and hear their history and all of that, that, if I see you once a week, I can get you better in a month, versus if I see you in a month, we've only taken a small step forward. And then knowing all of the modalities that go well with it, like if you add in a sauna treatment, with your massage, or a really popular one is to do whole body cryotherapy right after dry needling,
Okay.
are some good combinations. So we can put on the wellness prescription that, we recommend this, and this for you. And it's a nice guide, I think, for,
Okay.
for our clients.
Gotcha. So when it comes to physical therapy at Restore Therapy, kind of tell me what it's like and someone who goes there, like
Mm-hmm.
what they're going to be experiencing when they do physical therapy at the spa and like what kind of patients do you usually see for this?
I see all kinds. Um, so their typical experience would be they need to do an evaluation the first time. So that'll be a 45-minute session, and I'm going to sit down with them, talk about what their concerns are, what their goals are, what treatments they've already tried, because I don't want to do the same thing that they've already had done. And then talk them through, if they never had dry needling before, giving them a good explanation of what they're going to expect, make sure they don't have any concerns and things like that. So once we get through that part, I do an evaluation. So I'm looking at how they move, I'm looking at how strong they are, if they have range of motion restrictions. And then we go into treatment. So usually I do massage first. So I'm looking for where those knots are, kind of like the massage therapist does. But then once I find the knots, then I'm doing the dry needling to help release those knots. Then I finish it up with hot towel and massage when I'm finished. And then I usually either stretch them and or give them stretches to do at home.
Gotcha. So it seems like you're getting almost 3 services in one, because you offer stretch therapy and you offer massages. So kind of, I guess stretching as a whole is a good thing to discuss, because someone like me,
Right.
who has worked construction and like warehouse jobs, like it's important for people to be doing stretches no matter what they do.
Correct.
So what are some of the like most important parts of the body that you need to stretch out every day?
That depends. And one note about stretching is that you have to be careful with stretching, that you're not trying to like stretch out through a pain, which is I find a lot of my patients try to do. They're like, this hurts. I'm just going to keep stretching it and it's going to feel better. And they end up making themselves worse. So one guideline I always give my patients is stretches should feel good. They should not create any pain. So, keep them tolerable. But really just balancing the body out. I think yoga is excellent. I think that's a good way to stretch in ways that we don't normally put our bodies. But then, individual stretches really depends on the person and the job. I mean, someone who's using their arms and stuff is going to need to keep upper body and the back loose. Somebody who's walking around all day, or someone who's a marathon runner, they're going to keep their legs.
My job, right? Like quite literally, I'm doing a bit of everything, because I get at least 10,000 steps a day, no matter what. I'm walking around no matter what. And most of the time, I'm putting boxes of books on the shelf. So I'm walking to go use my upper body.
Perfect,
So it's
yeah.
like I'm kind of using everything. So in general, I guess, what would you say for someone who's doing a little bit of everything like myself?
I would say, since you're going to be walking all day, calves need to be loose. Your spine needs to be loose. So you need to be doing twists. I
Okay.
think would be good, again, as long as they feel good. And then for most people, like the pecs, the front of the body needs to be stretched out, because most of us spend a lot of time in this forward position. But yeah, really just, I think a good yoga program once or twice a week is crucial for somebody who's that active.
Okay. Katie told me about the YMCA. It has a good program.
Yeah.
And also like YouTube and stuff like that too. But it's one of those. It's like going to the gym and all that sort of stuff. A lot of people have a hard time just fitting that in, I guess.
Yeah.
Or
Yeah.
they make excuses.
They
know?
do. Yeah.
I try to I try kind of periodically stretch throughout the day. So is that something that's fine to do?
That's fantastic.
I gotcha. So we already talked about dry needling and stuff like that. So what's your best 3 services all around that you say you can't live without? I'm assuming now you own the spa and have all these services that you do them all yourself, right?
Yeah, I
In
do.
your spare time. So like, what are your favorite 3?
So other than, if we're not talking practitioner services, because like massages are amazing and the facials are phenomenal.
Yes.
Yeah, I mean, you can't go wrong there. But the basic services, I'm doing whole body cryotherapy, especially with the new machine. I'm in there every day that I'm working, so that's an easy one because it's quick too. Like if I
Yes.
have to get home to make dinner or something, I could just do it and go. Sauna is another one, and then Balancer Pro
Okay.
is the third. This again that goes back to the lymphatics and how important that is, especially with my lymph nodes being removed on my left side. I have to make sure that I'm really keeping up with lymphatic movement.
Okay. Now, you have memberships there, which I think, like, whenever I'm telling anybody about the spa, I'm like, look, if you're going to go there for more than one visit, like, you might as well just get a membership.
Absolutely.
It's great value for what it is. So do you want to talk about a little bit about each of the memberships, what you can get?
Yeah, we have 4 membership levels, and then we have massage memberships and skin therapy memberships. So really, it kind of builds up. The most inexpensive one is $49 a month, and that you get 2 basic services. So you could come in for cryotherapy twice. Normally, a session is $45. So you're right. It's you might as well get the membership if you're going to come twice.
Exactly.
Yeah, no brainer. And then as we go up in the services, you get premium services and pro services. Premium services are like an hour massage or an hour facial, or a pro service is a 30 minutes of either of those, or a bunch of other services that we offer. And then the level 4 is unlimited.
Yes.
Yes.
All right. So when it comes to like the benefits of cold exposure or cryotherapy, I was curious because you just recently got a new machine.
Mm-hmm.
How did the machine get inside? Because it's a big machine, and I can imagine like the doors aren't very big. So I was genuinely curious, like what was the process of getting that new machine like?
That was a day. And I'm not sure how my husband survived that day. It started off with he and I trying to get the machine in, and various staff members assisting. A bit frustrated with the company because they promised they would bring it in and set it up for us, and that didn't happen. It was just kind of dumped outside. Yeah, and it's big.
Because the normal person knows how to hook up a cryotherapy machine.
Yeah, right. So my husband, bless him, figured the whole thing out, but he was there and it was his day off, and he was there the entire day. So yeah, we called in some reinforcements. I helped him as long as I could. Then I had to go see patients, and I didn't watch the latter part of it, but we got it turned and in. I mean, we had maybe a centimeter a gap on each side after we took out the door. I thought we were going to take the whole door frame down or something. But we got it in.
Yeah.
It's fabulous.
Now, I imagine it's one of the most popular services that you offer. Mm-hmm. How often were you getting asked on a regular basis, like, when is the new machine going to get in?
Oh, that was awful. How long was that? That was 6 months. Yeah, because we had sold the old machine. So the old machine was run on nitrogen, and the new one's on electric. So this one's just a lot more efficient.
Was it the same, similar build setup and everything like that?
No, it's a big tube. So you went in, and the nitrogen, and then the component was in the back. And nitrogen tanks, 600-pound nitrogen tanks we'd have to have delivered. We usually had 4 or 5 at a time back in the closet. And they had a temperament of their own, I would say. So you would have to hook those up, and it would pump the nitrogen in and create the cold. So this one's different, that it's electric. So the machine is on all day, and so it's just like a big freezer, basically.
Okay.
And then it
seems much better.
It's better. And then there's sensors in it, which is really nice. So it makes sure that your entire body is getting cooled evenly. So before you would feel cold mostly in your legs, a little bit up into your torso, but your arms and your neck and everything didn't feel that cold. Now you are 100%.
Yeah, I've seen these cryotherapy rooms. Basically where it's like a room that you enter, and it's like, you ever done one of those?
I don't really know how I'd feel about my head being in there. I've never tried it, but the one we have, your head sticks out the top, so you're not breathing in the cold air.
Yeah.
I feel like I would feel claustrophobic or something like that. So I don't know. There are people that love it, but we had clients specifically that, as we were looking at the new machine, they said, if you get the one where you have to walk in, I'm not doing it because of claustrophobia and different issues.
Well, there's also been some like horror stories about those things, I guess, getting like locked or just, malfunctioning and stuff like that. And it's definitely nice to have your head out, because I'm on the shorter side, so I've experienced where like half of my face is getting hit with the cold, and there's a difference for sure. It is nice to just have your head out, because it's kind of like your only bit of sanity, I guess.
I know.
Yeah. It's definitely it's an experience for sure.
It is.
And a lot of people have been recommending like taking cold showers. Have you ever, have you heard of that being kind of common?
Yeah. We were kind of talking about that with the cold plunges. So it's a similar idea that if you turn your shower to cold, you can get a similar benefit. and I believe you can. I don't think it's quite as extreme if you
Oh
compare
no,
the two.
definitely not.
Yeah, yeah.
It's hard to. I'll be honest. It's hard to turn the shower knob to cold.
It
'Cause,
is when you're
you know.
warm and cozy.
Yeah, I mean that's kind of you're used to that your whole life.
Hmm.
Um. So on to heat exposure. So in the sauna and the salt room, you have the it's is it the infrared lights? Is that they're infrared lights?
Infrared. So we don't have that in the salt room, but we have two saunas, and that's putting out infrared heat. So that is basically it's like heating your body from the inside out. So the infrared penetrates deep into the body, so it's different than just being in a hot sauna. Like it doesn't have to be as warm to get the benefits, which is why I really like it.
Okay, what I meant was actually like the lights that are
Ah,
in
the light
both.
therapy.
Yeah, so
Yeah.
what kind of light is that?
Well, I don't know a ton about light therapy, but what I do know is the different, I guess, colors on the light spectrum are going to provide different benefits to the
See,
body.
that was interesting to me when
Hmm.
I saw the chart with all the different colors and what they do. I
Hmm.
was like, I had no idea that laying under different, different color lights would do different things. The only one that I've heard like on a common basis was red. You
Yeah.
know, I think that like does something with is it melatonin? Does it do something with that?
It is good for skin, but it's good for mitochondria, so it's good for the energy building parts of the cell. Um, so again, I don't know a ton about that, but yeah, it has to be these certain wavelengths of exposure go in and affect your cells differently. So yeah, every color has a different wavelength.
Okay. And then my dad kind of brought this up when we were talking about saunas. There's like a whole history with sweat lodges and stuff like that. Um, Now, there's like a dilemma of like hot and cold. I was actually in the waiting room one day, and this dude was like, "Hey, I noticed you're doing sauna and then cryotherapy." He said, "I didn't know if you could go from hot to cold." So, kind of talk about that.
Yeah, the contrast is nice. The only complication with going from a sauna to cryo is you can't have moisture on your body to get
Right.
into cryo. So you'd have to, I guess, stop sweating enough and dry off, and then you can get into
Because it
cryo.
can burn you, right?
If your skin's wet, yeah. So we just have to make sure that you're dry going into it. But yeah, the contrast therapy is always good for improving blood flow.
I gotcha. So, I just felt like it was good to kind of break that up in case anybody was confused on that.
Yeah.
You brought up facials earlier.
Hmm.
Very, very relaxing.
Yes.
Like I had no clue how relaxing they would be.
Yeah.
And I wanted to bring this up at least on a small topic. I feel like there's a stigma for men
Hmm.
against, skincare and like taking care of your face and getting facials.
Yeah.
There's dudes out there that if you were like, I went and got a facial, they'd be like, you're gay. So I kind of wanted to talk about, I guess, breaking that stigma. What do you think?
Oh, I think, like you said, it's very relaxing. And I mean, guys have skin too, and they want their
Yeah.
skin to look good. Yeah, and at least women, for the most part, can put makeup on and things like that to, to help their skin. But yeah, what we're all about is, treating the skin from the inside out. So it's that holistic approach to skincare. So it's not just about what creams and lotions and things you're putting on the face, but it's what's going on inside your body. So we do skin mapping, which helps the esthetician determine, if you tend to have breakouts in a certain area. Let's say you always break out on your forehead or something. That is an indication of this part of your body needs help. Maybe it's your intestines, maybe it's your kidneys, something like that. So it helps you kind of gear towards, and then we have supplements that can help to support those parts of your body. And then even you can help to detox your body and your skin, and then your skin looks amazing and your body's becoming healthy at the same time.
Okay, and I noticed at the spa for the facials, and you sell on the side the Osmosis skincare. So what's kind of the story with that? Because I use it; it's good
It's
stuff.
amazing.
So how did you choose Osmosis?
I don't know, it just kind of evolved, and I really appreciated the holistic components that they brought everything together, and that's really what we're all about. So it seemed perfect that they had the skin mapping, they had the supplements, and then they're non-toxic and everything's clean, but effective.
And it's like medical grade stuff,
It is.
basically, right?
Yeah. Yeah.
So compare that stuff to what you could buy at the store, like those Neutrogena,
Oh,
twin packs and
that's just
stuff.
like mineral oil and water. I don't even know.
Because yeah, I've been on both sides.
Yeah, I mean, you can't even compare it.
No,
I
you
mean,
can't. You definitely
you
can't.
put it on once and you can feel the difference, but it's just main thing is that you're not filling your body with toxins and like I said, the endocrine disruptors and things like that. You should not be putting those on your skin on a daily basis.
So that's arguably more important than like it would be more important to use better stuff, I guess, less than to use bad stuff all the time.
Yeah, and the good stuff you don't need to use as much because it's actually helping the quality of your skin and it's concentrated. It's not diluted like the stuff you're going to get at the drugstore. So, yeah, it's well worth the money.
Definitely. Seeing what else we can possibly fit in. So I was curious about this. You're doing IV drips in the future, right? So talk about what exactly the IV drips are.
Yeah, that's actually my entire day today was spent working on this.
Perfect.
So yes, so yeah, I just registered for a course where I'm going through all of the specifics of IV therapy. But yeah, so IV therapy is just concentrated nutrients that you're putting into an IV bag and it's going into your bloodstream. So the benefit of it is that you don't have to deal with your digestive system and the gut issues that most of us have. So a lot of people will take vitamins or eat food that has great nutrients, but it's not getting into their bloodstream or to the tissues where it needs to go because their whole digestive system doesn't process it properly. So this makes sure that it actually gets in directly into the bloodstream.
I gotcha. Now, I've seen this kind of used online and stuff like that. Correct me if I'm wrong. These are good for like hangover type situations where you're very dehydrated and lacking of electrolytes and minerals and stuff like that. So, I'm just curious. Is there going to be like group sessions available or is it going to be like,
Not
solo
necessarily
things?
solo things. Yeah. So that's the specifics we're going through. That to get the IV drip, you have to meet with a nurse practitioner first. That will be most likely a phone call or virtual, just to talk with them, get your history, and make sure that you're safe to do the IV. And then
Right.
you'd come in for your appointment and do the actual IV with an RN.
Yeah, I got a bachelor party and a wedding coming up
Okay.
later this year, so I was
Nice.
like, that IV drip sounds like it would be nice.
Yeah. There are places that will do like on-site drips, but we're definitely not there yet.
Yeah, I might have to look into that for the
Yeah.
boys.
Yep.
So like what other scenarios would someone go like what scenarios would somebody go in to get an IV drip?
So there's a lot of different options. Wellness is a biggie. Just wanting to detox the body, wanting to help support your liver. Energy, headaches, things like that. And then there's more of like the beauty side of it. So there's beauty drips to help with collagen to help your skin glow. And then there is the athletic side of it that's pretty popular, athletic recovery and performance. So
Okay,
just,
that's kind of what I was thinking more or less.
Mhm.
Okay. So I had an interesting question about Reiki, which is something that is, I suppose the way to describe it is similar to a massage. It's non-contact. It's a transfer of energy.
Yes.
So does the person that is receiving Reiki, so if I'm receiving Reiki, is it important that I kind of believe in the ability of Reiki?
Depends who you ask. Um,
Because if I'm sitting there going like, oh, this is nonsense, I'm not even being physically touched, am I then not really going to receive any benefit because I'm not really even receiving the energy?
Yeah, I mean, when you're talking energy work, I mean, again, there's many theories on this. If you're blocking that energy, then probably. And then, or if that placebo effect that if you believe this is going to help you, then it will. But I've seen profound changes with Reiki before where it's just unexplainable. It really is. Like a friend of mine does Reiki in Philadelphia, and we did a phone call Reiki session.
Oh, wow.
I had a horrible pain that went away within minutes,
Wow.
and I couldn't explain it.
Phone call Reiki. I haven't heard
Yeah,
that one.
yeah.
That's interesting.
Hmm.
Okay. Um, so I think it's important in general just to be taking in the energy. Like I try, like whenever I'm getting a massage or a facial, I try to just like kind of obviously like it's best to just relax as
Right.
best as you can, but I try to like take in the energy and just, obviously the person that you're receiving the massage or whatever from, they're trying to care for you in that situation. So you just got to try to like take all that in as well as whatever it is they're doing. I think it improves the
Oh yeah,
it improves the service no matter what.
absolutely.
Um, we're at about the 45-minute mark.
Okay.
Did you want to call it for this one?
Yeah, that's probably good. I mean, I
Okay.
think we covered most everything.
Yeah. But we can definitely try to get in again, and we can cover whatever we didn't cover.
Okay.
We can try to get it in.
Okay.
Is there anything else you wanted to talk about or promote?
I don't think so. I think we covered a lot.
All
Yeah.
right. Just be sure to go follow Restore Therapy Spa on Instagram and Facebook. Go check out the website. The website's a great place to go and figure out exactly what it is you need to do. I recommend getting a membership. Get your health and care, folks.